professionals in the field and addiction and treatment specialists in the field. And the work that they do, we have something called SPERT, which is a tool to actually identify if someone has a substance use disorder or opioid use disorder. So that's a tool that you can use clinically. But as far as in the home, I think you would be looking for, we created an infographic, shameless plug. We have a toolkit on our website where you look for those signs and symptoms. So if they're moving away from their loved ones, if there's some type of different moods, that this is normally not them, like loss of appetite, loss of motivation to do anything. There's a lot of different signs and symptoms physically as well, with your body. If there's
loss of weight.
Yeah. Fatigue, there's different things, all Googleable, of course, but yeah, I think the main tool is really your interaction with the person has changed, and they're like kind of their day-to-day routine. I mean, somebody's going different ways, or if they're not coming home, if they've missed work for 3 months, things like that are like really key telltale signs that something might not be quite right, or that high and that low really jumping really quick from being like really low depressive state to really manic high state. Those are things that I know I would look for in my loved ones. And if I had a loved one, then I think that would do it. I kind of would simply, I'm really straightforward, no chasing. I would kind of just say, you need someone to talk to. Let me know if you have anything. To open that door for conversation and know that there's not a stigma against if there is some type of substance use going on and, that they need help with. So I think kind of just always having those self check-ins. You okay? How you doing? And if it's an older loved one, just making sure, that they're not overtaking certain medications, and we have that opioid use problem that, we see an epidemic that's going crazy right now.
So if you see it affecting your life, or if you see it affecting someone else's life in a negative way, it's a good time then to step in.
Well, yeah, you wouldn't really know if it was negatively affected.
Don't worry, words are hard.
Yeah, I don't know why I'm not talking to it today, but I don't know if you would really know if it was negatively affected until after the fact. So I think that beforehand, talking just regularly with someone would be more effective, in my opinion, than kind of after the fact. Like, oh, I see, you lost your job, that you've held for 20 years, like that. There would be a little too late. And there would be signs before something like big and impactful like that. But yeah.
So what are some programs or some methods or policies that have been implemented? For example, in Italy, they decriminalized substance use, making it less of a criminal charge if you're getting caught with such like marijuana. What are some things in state or in the U.S. that you have noticed that have begun ways to better the community?
So I think a policy that was implemented in Louisiana is that you can bill for more than one mental health diagnosis at one time. Again, please don't quote me, but that was when I was talking to a Louisiana provider, because under the Opioid Response Network, which is one of the grants that we hold at SATTC, I cover Louisiana, Alabama, and Georgia. So I really specifically focus on those 3 states and what their needs and challenges are. And so they were saying now, before they couldn't bill for more than one diagnosis on the, kind of like the bill, like a receipt for what they charge for and what they bill for in coding. So that's different. There's a lot of co-occurring disorders, so we can't ignore that and only bill for your schizophrenia, but we don't address your substance use problem.
Right.
That was something that was really big, and now the fact that you can bill for more than one thing, I think is awesome down in Louisiana, because I didn't think a lot of people knew that.
Right.
Another thing I think is this parity law that was put in place for behavioral health and mental health in general, of where you can bill for certain things, and why certain things aren't covered at the same level. Now we're speaking on diabetes as being the same as a substance use disorder and handling it as such. So why aren't you able to get coverage for your counseling, or going to see an LPC, or going to your get recovery treatment, or your MAT? Why? Medicated assisted treatment is short for MAT.
And what is LLC?
Yeah, LPC is licensed practitioner or counselor.
Okay.
Professional counselor. So if you're going to see certain people in the mental health and behavioral health field, you're able to get the same level of coverage in your insurance that you would for any other chronic disease, infectious disease, STDs, STDs, HIV, anything, it would be the same type thing. Before we weren't seeing that. We were seeing where it was out of pocket, that, you know, it was so like, you know, little coverage, like maybe $50 and you paid the rest. So really cool out of that parity law. And we actually did some work in our research department here with health research and policy at NCPC and MSM, where Megan Douglas talked about that in detail with the parity law about, you know, that equity, health equity factor where you're, you know.
What are some ways we as citizens can do to help decrease substance use in America?
I think that we can decrease, this was like one of those Miss America questions. Thank you. Right. I think that decreasing really honestly would be to address the local issues that are faced. I mean, I know in the African American communities, which we focus on, there are underlying reasons why we use substances to cope with other things that are going on. And so I think any type of positive programming in our communities is kind of deterring us from using substance use. And I think that CATCA, which is Communities for Anti-Drug Coalitions of America, I think they do an awesome job at anti-drug use and drug prevention. And so a lot of what they do is just really focusing on the youth and actually programming where they are not so focused on using drugs and other substances that might be affecting them. So I think that starting with the youth and prevention, that would be definitely ways that I think that we could kind of like circumvent the problem and start really before it happens. And really, programming for people that are dealing with it as well. But I think that, yeah,
destigmatizing, getting help when asking for help. Okay. Another question I have is how do we are there any affordable ways to treat substance use for low-income citizens? I know another stigma is that it's a rich man's problem being addicted to substances. Mm-hmm. Not a lot of poor people can either do that, or they're going to get themselves into homelessness that way. But are there any programs that are for low-income citizens?
So I think that varies from state to state. I'm not sure about actually what is covered here in Georgia, but I am a little bit familiar in Louisiana because I deal with a provider who actually knows about a lot of grants. And so Medicaid, I think in a certain grant, Medicaid in that area will cover, I think, 30 patients, and they'll see them for free. They'll allow them to see a provider, and the provider will get monies from the actual government off that, not from the actual patient. So I think that's a really good way. I'm not sure many in Alabama either, but I do remember Dr. Jones briefing me on the fact that Medicaid, actually there are ways and grants for sure where Medicaid will come in and cover the cost to ensure that about 30 to 40 patients can get Medicaid-assisted treatment.
Okay, cool. All right, so final question. I know there are some different forms of addiction treatment. And different ways that we can get off more addictive substances like painkillers. There's some merit about medical marijuana. Are there any other substances or treatments that you know of that are better to curb substance abuse or substance use?
So it depends. So I'm a bio major by trade, so it's different ways to treat different substances. What you would treat for alcohol disorder would be different from, like opioid use disorder. So there's different ways to treat different things just based off receptors and how they hit different receptors based off the drug. But there are alternatives for opioid use in particular. There are alternatives that people use, the patches. There's different ones. Marijuana, I know, is a really big thing. It's not evidence-based when it comes to treating opioid use disorders, and I know under a lot of the grants that's typically not something that we lean towards as far as being like a modality to treat, because it's not evidence-based. Everything's evidence-based when you're doing government work. Right. So it has to be evidence-based, proven, factual, like multiple times through repetition. So, and then I actually heard from a physician in Georgia that they actually found out that either vitamin C actually tickles the same receptor, and so when you are actually getting medical assisted treatment for opioid use disorders, coupling that with vitamin C, helps it take better or something like that. So that was really interesting to know. And psychedelics, I know we were talking about that earlier before we started, that he also stated that as well. So that's something that's catching on, that those are used as well to treat. But yeah.
Okay, I want to thank you. You guys are my first government organization that I worked with or interviewed in this case. And I want to thank you for being here and being part of the channel.
Sure.
Can you please tell me where you can find more information about what you do and where you're at?
So we are the Southeast ATTC, so you can go to attcnetwork.org. We are on all the social media channels except for Instagram. So we have a Facebook, we have a Twitter, we have a LinkedIn, and we also have, I think that's it. Oh, we also have a YouTube channel, but that's mostly where we house just webinars. But check it out as well. But you can check us out on most social medias, but definitely attcnetwork.org, and then you can go to all the centers, and it'll show them by region, and then we're Southeast.
All right, and then I'll see you guys next time. And that wraps it all up.